evening and welcome to our panel, Being Black at the Doctor's Office. For this program, Black Doctor has partnered with United Healthcare to talk about what it means to be Black at the doctor's office. Tonight, we have assembled a panel of healthcare leaders and professionals who also have instrumental roles with clinicians and patients in healthcare. Of course, I am your host, Dr. Renee, and I am so excited for this conversation because it's a much needed conversation. So I'm going to introduce my guests now. First, we have Dr. Tamika Lashige. She is a pediatrician and neonatologist who has over 10 years of experience in managed care leadership. Dr. Lashige currently serves as the Chief Medical Officer for Georgia Medicaid at United Healthcare. Dr. Lashige leverages her formal education, personal and professional experiences, and her passion to enhance the lives of children and underinsured populations with quality health care through direct patient care and advocacy. Dr. Kenneth Poole Jr. is the Chief Medical Officer for Clinician and Provider Experience for United Health Group. In his role, he is primarily responsible for improving the United experience and creating an environment that fosters clinician connectiveness, both to the enterprise and to each other. The goal of his work is to develop an invigorated, distinctive health workforce, a transformational cadre of clinician leaders, and the next generation of clinical talent and leadership through education, apprenticeship, and mentoring. And finally, we have Micheline Davis Esquire, the President and Chief Executive Officer of National Medical Fellowships, Incorporated, founded in 1946. NMF was one of America's first diversity organizations and remains the only national organization advancing health equity at the intersection of wealth and health. It provides scholarships to Black, Indigenous people of color, medical and health profession students underrepresented in medicine to ensure equity of access to culturally competent, high-quality healthcare. NMF also increases the number of BIPOC clinician leaders to diversify clinical trials. A longtime healthcare administrator, Ms. Davis brings her experience in policy, law, and health equity to the NMF legacy. Welcome this evening. You guys can say welcome. Say hi.
Thank you for having us.
You're welcome.
Excited
Thanks
about
so
the
much.
conversation.
So United Healthcare believes that the relationship you have with your doctors and care team must be built on trust and respect. It is critical that we have providers who understand their patients' perspectives, experience, and culture because it improves patient satisfaction, understanding, and outcomes. Currently, only 6% of doctors are Black, falling far short of our broader population. In response, United Health Foundation, the philanthropic arm of United Health Group, has made a $100 million commitment to advance a more diverse health workforce by providing scholarships to current and future underrepresented healthcare professionals. I'm very excited to talk about that further later on. But first, let's start talking about how have each of you experienced significant, how has your personal experience significantly shaped your health journey? And we can just start with Dr. Lashige.
Yes, thanks for having me. I would say the most significant memories and experiences that shaped my journey with the medical field began as a child. I grew up in a multi-generational household, and we all relied on Medicaid or Medicare benefits for all of our healthcare needs. Thankfully, my brother and I didn't have serious medical issues, but I recall sitting in my pediatrician office finding no relation or connection with the doctors or nurses. Even worse, I watched how they felt that they didn't communicate directly with my mother, and frankly, it felt disrespecting the way in which they talked down to her and to us. So I sought out to become a pediatrician that I felt like I needed as a child, one that understands me and would provide quality care, including a positive experience.
Yes, it's so important for us to see people that look like us in these positions, and I was fortunate. I actually did have a Black pediatrician. So, Dr. Micheline, we'll make the male go last.
Thank you once again for having me. I'm delighted to be here with such esteemed fellow panelists. I really want to say I actually think that the incident that sort of stands out in my mind the most is not one that necessarily involved me as a patient. It was me as a daughter. And I distinctly recall accompanying my father. My father was like the rising of the sun to me. He was a bishop and a community leader and someone who, quite frankly, made the world better just by being in it. I distinctly recall going with him to a physician's appointment, and we came into the room and we were happy, we were talking, and I was chatty patty as a child. You have no idea. And he was so wonderfully gracious that he always endured me or tolerated it. But what I distinctly recall is the fact that the doctor, when we got to the appointment, entered from the opposite end of the room, stood by the door, spoke to my father, and concluded the appointment. What I saw was the fact that my father, this proud, um, just loquacious individual, his entire countenance changed. He suddenly looked downcast. He had he had a frown on his face. I distinctly recall the fact that he very quickly got his jacket and said, "Come on, dear, it's time to go." And I was taken aback at what was going on. I was unaware of what was happening. And as we entered the hallway, he said to me, "Sweetheart, that was supposed to be a physical. How can he give me a physical when he never even crosses the room to touch me? How can he possibly give me care when he is too afraid to touch me?" That, my friends, really isolated for me how incredibly important it was to have both culturally competent and culturally humble care.
That's awful. And I can kind of relate to that. My father, unfortunately, had several strokes in COVID. And so we couldn't go to the hospital. And my father is a foreigner. He's from the island of Antigua. So he has an accent anyway. But then, of course, he had a stroke. So he had aphasia. So his speech was slurred, plus the fact that he wasn't making sense because of the expressive aphasia. And they lost his clothes. So my mom went to get him to take him to the rehab, and he had no shoes, no clothes at all. Like he was just some homeless man. I was like, and it wasn't that we didn't visit him, it was we couldn't visit him, but we called daily, multiple times a day. So it wasn't like they didn't know that he wasn't cared for. And I also did pull the card and say I was a doctor too. None of that mattered. It was really appalling. But I will say kudos to the hospital for having their whoever's in charge. I forget the name of the department. It's like with customer service or something. They called me and spoke to me and reassured us that everything was going to be okay. And I said okay, because he ended up being hospitalized twice more. So. But yeah, I completely understand Micheline because my dad too. The sun does rise and shine. I call him the king of our castle. So, Dr. Poole.
Yeah. Again, I also want to thank you for the opportunity to be on this panel and to have this discussion, and certainly fellowship amongst you distinguished colleagues. So in answering the question, giving this a little bit of thought, I think that the experiences that have shaped my journey are actually things that have happened since I committed to the process, right? So I didn't have any, specific events that triggered me going into a career in healthcare. I mean, there were a lot of different things that I can tease out and that I've mentioned on other occasions. But once I started this process, meaning started medical school, going through residency and such, I can remember specific circumstances where not only did I feel that I didn't belong, but I felt that um, my feelings of being an outsider were because of the intentional actions of others, meaning that there were others that felt that I should not be in this space. And over time, that fueled me to not only stay in the space, but really lean in and try to influence the space as much as possible. And so I think that the negative experiences that I had in medical school, some in residency, even in practice, really drove me to be motivated to be part of the solution in terms of creating a better healthcare system for everyone. And I feel fortunate to be in a position, particularly in an organization like United Health Group, where I can do just that.
Yes, that is true. It is because we are still quite the minority when it comes to medical school and residencies, and and even in jobs, as you said. So, how have you all personally felt the impact of underrepresentation in healthcare on your health outcomes? I know, Dr. Lachey, you kind of touched on that a little bit.
Yeah. Again, a lot of my experience comes through my loved ones. And so, from my parents to my grandparents and even my great grandparents, I witnessed some negative impact of underrepresentation. So, watching and witnessing family members navigate the effects of high risk pregnancies, substance use, chronic illnesses like high blood pressure, all the way to terminal illnesses like AIDS. I watched the negative outcomes unfold based on, as a child, it appeared to be a language barrier, quite honestly, despite everybody speaking English, because it wasn't language after all. It was understanding, it was respect, it was empathy. Dr. Poole and I recently talked about this. There's a lack of education on our end, and it particularly around the topic of health literacy. And without the representation, there's a mismatch in cultural understanding and just treating people like human beings.
And whoever wants to go next.
I'll jump in. I think to piggyback on that conversation, on that comment, where I see it a lot of times is, and I know a lot of Black physicians can relate to this, is in being a backup, if you will, for when family members, loved ones go to the doctor's office. Again, just given the numbers and representation, even if everybody was fully intended on seeing a physician that looks like them or that communicates effectively with them, the numbers don't equate, right? Just given the system that we currently have. And so, but even still, at times there are people that perceive other physicians to perhaps be of greater competency or greater value. And like I said, where I see the underrepresentation unfold is in when there's some sort of negative outcome, or if there is something that again, friends, family members, or even family members of friends go through that they don't understand. Invariably, there's always the text message, the phone call, the email to the Black physician. Hey, can you look at such and such's chart? Hey, can I send you this? Hey, can you talk to this family member for me? Hey, this is what the doctor said. I don't understand. And more than happy to do that. Again, that's what we're here for. However, I always tell people, don't use this on the back end. Use this on the front end, right? Like seek out, some of these Black physicians that are in spaces that can certainly help you up front, as opposed to kind of using us as a stopgap, or again, when things don't go right or you don't understand questions that you could very much give to the care team that's taking care of you.
Right.
And I will speak from the position of National Medical Fellowships, right? We are created nearly 80 years ago in order to ensure that there was diversity in the medical field, right? And so as I look at the fact that we have a population across this nation, and then a proportionality of physician representation that has not kept pace with that 13.4%, the question you ask is, how has it affected us personally? Listen, it makes my stomach hurt when I look at the need and then look at the demand, right? And I look at where the supply is and understand, rightfully so, that it is up to us in order to ensure that the pathway is broadened in the face of things that would attempt to push us back, like the recent SCOTUS decision. One of the things that I will tell you is, we are fortunate because the three doctors that I'm looking at right now, and every single one of my scholars, are the best and the brightest that this earth has to offer. I tell people that actually when NMF walks into the room, I really should look around and say, and you're welcome. because the truth of the matter is that we are just creating access to opportunity for the brilliance that already exists, right? So when I look at that and I see the fact that healthcare disparities, we have not improved them dramatically since we started actually tracking them. What we realize is that the time is now, but it was also yesteryear, right? And the urgency is only compounded in order for us to actually achieve some true gains in these spaces, right? No one wakes up in the morning and says, and I'll have a bagel and a higher mortality rate. That does not happen. It doesn't happen, right? And what we know is that we know that racial concordance actually shows up and makes a difference in that patient engagement experience and then, in fact, in those outcomes. So if we know that, I say it all the time, that representation in medicine is literally the shortest, the most impactful, direct route to changing healthcare outcomes for the better. Lots of us can talk about the social political determinants of health. We can talk about building housing, right, for future generations. But if you want to affect the generation that is right here, right now, this is the way to do it. It is truly that representation. It is that opportunity for inclusion. Yes. It is having that lived experience. It is all of that. And then on top of that, having high quality, culturally competent, culturally humble healthcare delivery. So that's just what comes.
And I want to make sure our audience understands fellowships. That is what, so the doctors, they go to medical school, then they do residency, and then to specialize in all of these different fields, like your GI doctor, your gastrointestinal doctor, your reproductive, if you need a fertility doctor, your allergist, your pulmonologist, all those people do fellowships. And that's what Micheline is trying to help to get people in. And I have a perfect example. I went to the allergist today. He is retiring. He is one of us. I am devastated. Before the pandemic, he was right downtown. No big deal. I don't drive. It's cool. I could get there. He is so far out in the suburbs. It cost me more to get there and back than my copay. But I went because that man is going to make sure that my lungs are good and that I can breathe and I can run and do all the things I do. So that's why I went. This is probably our last visit today because he is retiring in a few months. But I said, what am I going to do? So he said, and he said exactly what we've already said, that Black doctors are only like 5% of the population. And when you look for an allergist, it goes even lower. And I said, I know. But he did tell me someone that hopefully is downtown. But it's true. And we here at Black Doctor have talked about how there's been studies done that people actually have better outcomes when the doctor is a Black doctor. And that was one study was done on, I think it was on babies. Dr. Lashagay, you might know. And then there was another study, I think, that was done with adults as well. And it's just a matter of fact. And unfortunately, there are a lot of places you go and you're not going to find any Black doctors because you're in whatever town and whatever state, and there just aren't any, or they're not in the specialty you need. But I will say that the one thing COVID did give us is that telehealth is actually very effective. And, in some cases, it is the only way that you will see a Black doctor. And so if you can, and of course, we here at blackdoctor.org have a wonderful database of thousands of Black physicians across the country. And you can look them up by specialty and look in your, look at your city, state, whatever. So, but yeah, it is so absolutely necessary that you have someone that understands you, because when they have no idea, just like my dad, I told you he's not from this country, he has an accent. We had all sorts of things. We had somebody call us and tell us he was gone. He was declining. I just wanted to let you know, this is it. It was a hospitalist. Told us, this is it. He's just sleeping all the time. And now, mind you, we had just talked to him. Granted, like I said, he had expressive aphasia. He wasn't making a lot of sense, but we had just spoke to him so clearly. So when she called my mom and said that, my mother was devastated. She calls me crying and tells me, and I'm like, what? The man was depressed. For all intents and purposes, I would be too. He's not seen a single person that he knows. There's not a Black doctor in this hospital. I mean, that's taking care of him. No one is relating to him. There's nothing familiar. And so thankfully, like I said, finally COVID started breaking and we could start to, at least my mom could visit him in the window, and, and he started to, perk up some. But it is so very important that we have people that look like us and speak our language, whether that be, if it has to be slang, but someone who can explain things so that you actually understand them. Because I hate to say, there's so many of our colleagues that they act like they're talking to doctors and they're talking to patients. And then you have patients, I'm sure there's many people in the generation above us that they're not going to ask questions of the doctor, even though they did not understand a word of what the doctor said. But it's so important for you to understand. And it's important for us to understand that we are a team. The doctor is not dictating to you that this is what happens. We're a team. You have to work in a team fashion. So it's awfully sad. And just like you said, you don't order a bagel in mortality. Our life expectancy is so much lower than everyone else's, but it's because of things like this. So the next question is, what challenges have you guys faced in navigating healthcare due to underrepresentation, and how do you guys overcome them?
I wanted to, I can answer your question and then add some additional color to the great comments that you just made. I think a lot of times when we have these conversations around representation, a lot of times, particularly when we talk about spaces where we can move the needle, and I'm sure, Micheline, all the great work that you guys do in your organization, you're at the table for these conversations, but it gets people uncomfortable because, we talk about increasing representation and what it takes to do that. And I always like to level set and say, again, when you look at available studies on experience, everybody, all demographics rate having a higher experience when they have culturally congruent care. And what I mean by that is when the doctor and the patient are the same race or ethnicity, experience goes up, right? That's just across the board. The part that for us as Micheline and everybody here has pointed out is that we're so far underrepresented that we could not have that type of concordance if we wanted to. It's just not enough of us. And then when you add in the fact that that we have such stark health disparities, which equate, again, Dr. Renee, to your point, to decrease life expectancy, right? Again, which is like the ultimate outcome. It's imperative that we increase that representation in order to improve the outcomes of our patients until we figure out a way to make the system work better for everybody, right? Because right now it does not. So until that happens, the best thing we can do is make sure that we have enough Black physicians in play to service Black patients and patients in general. Now, to answer your other question around, the kind of some of those roadblocks and barriers, I think a lot of it gets exactly at, I'll go to the pipeline and experiences that I've had as part of the pipeline. And a lot of times when we think about the pipeline for medical education, we think about the beginning, right? We think about, again, the students that are interested, they're, them applying, a lot of even attention on the MCAT and things like that, which is a test to get into medical school, as we know. But the issues don't stop there. That's almost kind of like an appetizer, right? We know that there's issues related to admissions for medical school, even when, our applicants, so again, our young Black folks are scoring appropriately. There's issues related to the admissions process in terms of the advisement that they're getting, in terms of the acceptance rates, again, particularly for certain institutions. Once they get into school, there's issues related to attrition. So JAMA published a series of articles over the last, maybe about a year and a half, talking about students of color having issues in medical school. Even students that are enrolled in MD, PhD programs, which are like the brightest of the bright of everybody, when we talk about MD, PhD programs, and are still having issues there. Talking about, even when you look at success factors, race being the top predictor of success, even independent of income and poverty status and things like that. So we have those issues. We have issues related to USMLE. We have issues related to the match, as you were talking about specialties and advisement and what areas we should go into versus not. there's residencies, so on and so forth, right? We can kind of sit down and almost have a discussion over each area of the pipeline. And the resistance that's been that I've encountered, that I know you all have encountered, that countless others encounter along that pipeline without interventions from organizations, from governing bodies. I think that's where the problem is. I think there's a need for organizations, for bodies, for groups to really lean in on the pipeline, the entire pipeline, and kind of plug some of those holes in order to, again, get more of us through and ultimately to the bedside to see patients.
I'd love to jump in and co-sign on Dr. Poole's,
Yeah,
right? So all of that, right?
you,
All of that plus some. Um,
that's
uh,
absolutely correct.
I think that that is one of the reasons why it resonates so much, is certainly because of what National Medical Fellowships does. And so, Dr. Renee, um, uh, not only do we like to say that we are actually aimed on our new strategic framework to ensure that we have students from the cradle to greatness, right? So not only do we ensure that we are providing them with scholarships in order to actually get into medical school and pay their way through, but then service learning programs so that they have that actual practicum. And then, once they graduate, we're also bringing folks back as physicians and giving them training in order to become emerging investigators. So when we talk about, right, so what can we do about this? How do we overcome it? We overcome it through all of these avenues. We overcome it by investing to entities like NMF and or others that literally are doing exactly this work. I love what Dr. Poole said about, he said pipeline, I could say pathway, right? We really have to make certain that we are broadening and widening the funnel in order to get more students in. And that comes through collaborative opportunities and partnerships with other entities that are perfectly suited in order to introduce the educational opportunity of a career in healthcare at the earliest stages. And then partnering in a way where, quite frankly, we are wrapping around them so that at each stage they have another entity that is culturally relevant, that is particular to where they are at the stage of their educational career, and literally is able to come around them, lift them up, and be able to bring them through, right? Because we know about those structural and systemic issues that are always there, have been there, will continue to be there. And right now, folks feel, they're getting a little jiggy with it, right? They're starting to think that they get a little emblazoned. And so we want to make certain that folks understand that you can't come from me and mine. This is our community, right? That we have them. We know how brilliant they are. They are just as brilliant as their ancestors were, but we want to make certain that they have the opportunities that their ancestors did not, right? And so what do we do? How do we overcome them? We overcome them through fantastic partnerships like that which NMF has with United Healthcare, right? And so literally they are a long-term, long-serving partner that has really been making certain that we are able to change the face of medicine and advance more diversity into clinical practice as a result.
Yeah. And what also scares me, of course, is that in the year 2024, we are worried about the affirmative action programs disappearing, and you can't, what is it, you can't put race in the application, just all sorts of things that really would be huge barriers to any future doctors out there. Dr. Lashige, did you want to add something?
Yeah, I'm sitting here resonating with what you're saying, and we all know that so much communication between a patient and a doctor is nonverbal. And that's why this understanding that we're talking about in this relation is so important. Being able to connect and relate with your doctor is key to developing a trusting relationship. And if you don't trust your doctor, you're not going to follow the instructions and so forth.
Oh no. Okay, hopefully Dr.
And
Lashige.
so on.
Oh,
I'm
there she is.
thinking
Okay.
about on the patient side, right? See, department resides. And, we've all heard the phrase, your zip code is more important than your genetic code in determining your overall health. And so I will face the same biases and inequities that exist within the system. And, like many of us experience, this will continue to occur until I offer my unsolicited information about my career and possibly name drop some key physicians that work there. Will I get a little bit more improved experience and attention? And when we flip the stethoscope to become the doctor, Kenny talked about all of the challenges that we face going through the process. But when we actually are in the process as medical students, it's wild how many times we face a situation where we see the inequities, we're being taught how to care for people within the existing inequities, but we lack the knowledge and power to actually do anything about it. Right. In fact, I feel like for many years after med school, I still have flashbacks about being taught something that is fundamentally incorrect. And I sit with the challenge of trying to overturn decades of misinformation that are substantiated as medical facts.
Yeah. Yeah. It's disheartening, it's scary. Um, and it's just there's so many of us in this world. I can't understand how we have this shortage, but the shortage is bad. I mean, there's a lot. I had just was talking to a friend that is a radiologist, and none of the fellows are black, and they have like hardly any black radiologists. And I was like, but we're in Chicago. I mean, I could see if we were in some small little city, but we're not. So it really is it's mind blowing. So, based on your experiences, what advice would you give to individuals facing similar challenges in finding proper representation in healthcare? And I'm going to say something really quickly. As soon as you get one of these roadblocks that Dr. Poole spoke of, there's so many people I think that don't have the tenacity or the perseverance to keep going. But my thing is, please keep going. Ignore those people, because so many people told me I would never become a doctor. It was ridiculous. I mean, from the time that when I said it as a elementary school student to high school to college. So you have to ignore those voices, shut those people out, and just stay focused. So go ahead.
I'll jump in here. So I mean, let me ask you a re-clarifying question. Do you want the answer from the perspective of a patient or the perspective of a physician in training?
You can give both.
Right. So I think from the perspective of the patient, so I'll give both. So the perspective of the patient, I tell people this all the time. Know that like we're providing you a service. I think a couple of you guys even mentioned that, like again, like that older generation, just taking what the physician says and going from there. And again, in a safe space, let's say it, a lot of us will take the word of other physicians and not say anything, but then question us though a lot of times. I was like, make sure you question that other doctor the way that you ask questions that have skepticism around, what I'm telling you. But what I would say though is again, know that we're providing you a service and you're not beholden. I can't tell you how many before I worked at United Health Group, I worked at Mayo Clinic. Before I worked at Mayo Clinic, I had my own practice. And when I had my own practice, people would come in and say, you know what, I want to switch to you, but let me figure out what I need to do, or let me go see what the process is. I said, whoa. You don't have to have permission. Like, make an appointment and come and see me. And in terms of old records or whatever, we'll take care of what we need to take care of. You don't owe anybody anything. So tell me, we're providing you a service. If somebody's not meeting your need, you change. If the word isn't being spoke to you the way it was before, what you do, you get a new church home. If that financial person isn't telling you what you like, or if it's too long of a wait at that place you go to eat, you don't go back there anymore. Same thing with us in healthcare. If we're not meeting your needs, go somewhere else. You have to be the advocate for yourself. And I tell people that all the time, and we have to do a better job of that as Black consumers and patients in healthcare. Second thing then, as it pertains to physicians in training, I would just say persevere and look to folks that have had a similar experience as you, particularly those that are not too far removed from where you are in your level of training, and ask questions. Don't hold things in until it's too late. There's too many times you end up hearing from students after they've been asked to repeat a year of medical school, after they've been asked to remove themselves from school, after the residency program dismisses them. Once you start having issues, you need to reach out. Likewise, though, we have to do a better job as a system, both individual Black physicians, but then also a healthcare system as a whole at really supporting Black students, Black students, residents, young physicians, even folks that are trying to find a job, because the job game is a whole conversation in and of itself because there's no rules, right? But we have to do a better job supporting one another, supporting those that are committed to the process. I think all too often we end up giving a lot of energy to bring folks in, which we certainly need to do that, and there's room for that. But there are too many people that are squished outside of the pathway, as Ms. Shalene says, or that fall through the pipeline that we aren't supporting. And these are exceptional people that have already shown that despite all these barriers, they can get into medical school, they can get into residency, they can even finish residency, but they're not working, or they're not getting through their residency program, or they're only getting through a year or two of medical school. Shame on us for not making sure that those folks are okay first, right? Because they're already into the system, right? We have to do a better job there.
I again want to say to Dr. Poole's comments, ditto, right? That plus, I just to really put a fine point on it. You know, one of the interesting aspects is the fact that we also have to make certain that we do not divorce ourselves from community, right? And that when we go to the doctors, we have to remember that we have to teach. So I'm doing this first from the patient side, and then I'm going to come to you from the medical student side as well. And that is in reference to the fact that we have to be able to educate that physician on how we want to be treated, right? And how to treat us, right? So I traditionally tell folks, please take an index card, write down every pain, every ouch, every ouch, etc. that you've experienced throughout the time that whatever is bothering you, that's taking you to the doctor, so that you can take it out and read it to them. Oftentimes, one of the things that people forget is the history of African Americans in this country and the healthcare system, exploitation, right? Forced experimentation, forced sterilization, like, let's be honest. And people often say, well, that was so long ago. Was it? Because actually, experimentation was being done on special demographics in this country, even through the COVID trial, right? We use prisoners. Let's be honest. Let's talk about it in real time, because it's still happening today. We know that Black women were being sterilized in North Carolina, right, and Pennsylvania, and up until the 1970s. So let's be honest. And the reason why I talk about that is because oral history in our community is so rich that even if someone may not have read the book, right, they know the story. They know how physicians during the civil rights movement, right, and during Jim Crow, quite frankly, often showed up at the home to treat a patient and actually rendered harm instead. I remember hearing those stories when I was a child. So imagine about the way in which our communities know that, right? So we want to make certain that we are educating physicians when we're going into that experience. Take that note card with you. Find out what it is that quite frankly, you should be just entitled to, right? Ask for blood work to be done, right? I mean, oftentimes people are afraid to utilize the opportunity of that exchange to ask for what you need. And of course, so many of us don't actually know what it is that we need, right? I was talking to someone the other day, and she mentioned to me that, the Black woman, another Black female lawyer, who said, oh, I'm anemic again. And I paused and I stopped and I said, I need for you to make certain that you're not talking about that just like, it's not important, when anemia in Black women can be quite deadly, right? I talked to her about how it shuts down your organs, etc., right? And so those are the kinds of things that I just really want to make certain that people know about and are sensitized to. And then, quite frankly, so what can we do? I would undoubtedly reach out to Black Doctor in order to find, right, representation that looks like that. At NMF, we have some well over 35,000 alumni. We have literally given this country Black and brown physicians, right? And so they are actually out there and being able to connect with communities in order to make certain that we know and can find and be referred to physicians is incredibly important. Why do I mention the other piece about community? That is because of exactly what Dr. Poole said, right? If you are a student that is interested in going to med school at any stage of your educational career, connect with community. There is the Student National Medical Association. There is the National Medical Association. Hi, folks, there's NMF, right? We have active alumni council, and then we have an active young leaders council as well. So these are folks who have only, right, they've just gotten into their residency, they've just gotten into their fellowships, right? They are you just yesterday. And so really just want to make certain that we are surrounding you with the community. Understand two things. One, you do not have to do this by yourself, right? And two, right, there really are people who are here rooting for you. And I say that because you're going to walk into halls of institutions that were not created for your well-being, not historically, right? Because so many of them actually were segregated historically. And as a result of that, right, didn't contemplate that you would ever be walking those halls. So why would you ever walk those halls alone? So get yourself in community, wrap yourself around your ancestors, right? And let them walk with you and walk before you into each and every one of those settings.
Oh no, did she freeze? Dr. Lashige, you still with us?
I
Okay,
love
hold.
that.
There she is. Go ahead.
And be picky with your provider choices. Do your research, do your homework, choose your provider wisely, and know that you can change your mind and make a different choice later, right? We know that there's 6% of us that are existing right now. And so there's not too many to choose from. And there was a time when I lived in Minnesota and I was the only Black neonatologist in the state. That was daunting. But know that representation can go beyond race and gender, right? So for the providers that I choose for my family members, I look for everything. I pretty much become a private investigator via Google. I look at whether they are native or transplant to the area because I'm a transplant and there's commonality there. I look at if they've ever lived someplace else that I've lived. There's just so many data points that you can search for. I read their bios. I know that personally, I was a different pediatrician before and after I had kids. So I look to see, what family members they talk about. What do they do for fun? Because if their idea of exercise is ski shooting, we may be on different wavelengths when they tell me to exercise more, right? So there's so much criteria that you can use when choosing your provider. By the time I make my appointments, I've already developed a level of trust and comfort based on the pre-work that I've done. And when you get to the office, like Micheline says, ask all the questions and ask some more after that. Be sure that you understand what is being done and why. Be sure you understand what alternatives you have. Be sure you understand what's urgent and what's not. And if it is urgent, why is it urgent and how urgent is urgent? What's the short-term and long-term plan of your management? And at the end of the day, if you feel like you need to bring support, take an advocate with you. Like these are all choices and powers that you have to own as yours.
I think
So
I
I'm.
think I think that's so true. I'm sorry, Dr. Renee.
No, you're fine.
But I think that's so true. What Tamika mentioned in terms of really researching and doing your homework in terms of who to go to. I think the other thing that she pointed out is that she's got a level of detail and nuance as a pediatrician that somebody who didn't go to medical school may not have. And so still you can use her. Remember I said use this on the front end and not the back end. And so when I left my practice in St. Louis and joined Mayo, that left a void in terms of, again, the couple thousand patients that I had. Well, where I could still be a benefit is when people would ask, well, who should I go see? Because now I got insight. I know who just looks good on paper and like, you don't want to go see him or you know what, this guy is going to really take care of you. Because like you said, at a certain percentage, everybody can't go see a Black physician, right? But there are other physicians that will provide amazing care for us. And as their colleagues, right, as people who, number one, went through the process, number two, we're their colleagues, we know who you should go to and who you should not go to. Ask us. So ask, again, that Black family member, that community member, or whoever, or some other specialist, who do I need to go see? You said, Dr. Renee, after the allergy appointment, the guy was like, okay, here's a recommendation, right?
Yep.
And a lot of times, even if that person isn't a person of color, they know who they trust as a colleague and who would be good for you. And so I always tell people, lean on us, but again, lean on us on the front end, not after you went and it didn't work out and now you want to come back. And we'll help you then too, but we can prevent some of that, some of that headache if you get us up front.
we definitely need to continue this conversation and have this as a series, but just some other things. Make certain that you're not picking a doctor because that letter in the book or whatever. Ask people, ask the coworkers, the relatives, somebody. Ask people, because people have had experience with someone and they'll tell you, I went to so and so and it was awful. Or I went to so and so and it was great. The other thing is, as ladies, I know you understand, we will change a hairdresser like that. If she cuts your hair and you asked her not to, if you know, but people won't change their doctors. And I was like, hair and breathing and living, you guys, we have to take, put things in priority. And you need to drop the doctor just as fast as you would drop the hairdresser. Drop the doctor and get someone else. And just like Dr. Poole said, don't worry about your chart and all that. They will make sure that you're, legally, they have to release your chart. Even if they're mad about the fact that you left, they have to legally release your chart. So legally it will get done. The chart will move on and you can go see someone else. But please do not feel confined to sit there with someone who is not listening to you for whatever reason, and not hearing what you're saying or not explaining things to you so that you understand them. My other favorite thing now is these patient portals. Use that to your benefit. Micheline said taking an index card. I think everyone has a phone these days. Put the questions in the note section of your phone. Open the phone and say, okay, on January 5th, my ankle this. Take notes and make sure you record these things, because you can't remember everything, but you need to give the doctors a full picture so that they can help you. And if something happens and it's not something you need to run to urgent care or the ER for, send them a message in the patient portal. The physicians check those. They have staff that check those, and this information will get put into your chart and will help to treat you better. So, Micheline, I'm really excited for you to tell us more about this. About UHG's, United Health Group's commitment to change the face of healthcare, and the National Medical Fellowships partnership with United Health Group in fulfilling this commitment.
Well, I love the question, and thank you so much for asking it. This has been such a good and a rich conversation. I feel like I should be taking notes, even more notes than I'm already taking. I will tell you, United Health Group stands apart from so many other entities that, as we all saw, especially after 2020, began to drop statements, right, and issue certain releases about commitments. Unlike that kind of coming to the party after the fact, UHG has actually, for a long-standing period of time, we have probably been in partnership for over 15 years. So they don't just believe, but they actually have been demonstrating that everyone deserves to live a healthier life. One of the things I love about this is the fact that their commitment literally includes making certain that everyone has greater access to high quality, culturally competent care, as we discussed. And so we're delighted to be just one of the many entities with whom they have partnered in order to really focus in on diversity in healthcare scholarship. And so we offer that with them. It's a wonderful, fantastic program. I think we recently had 30 scholars in our first cohort. We just released a press release about it as well. And so their commitment is for $100 million over 10 years in order to make certain that they are truly advancing the numbers that we were talking about earlier are so dire. They want to make certain that in addition, that their programmatic dollars really do go to exactly the students in order to ensure that they are wrapping around them and providing them with the type of support that they need. So I'm really delighted about it. Through actually supplying these scholarships, we are able to change the trajectory of the lives of so many who are underrepresented in medicine. And so I'm delighted to be in partnership.
Dr. Lashige, Dr. Poole, do you have anything to add about the importance of this commitment?
I'll add that one of the things that should be pointed out is that as Micheline said, that our support as an organization has been to support people that are already doing it and doing it well, right? So, a lot of times, we'll see people kind of reinvent the wheel. A lot of times with, as it pertains to scholarships, different initiatives, and things like that. And where I think that this UHC's commitment and this initiative has been a great thing is that it's been in support of organizations, of scholarships, of people that have already proven to move the needle in this space and to have high impact, and to essentially just support that, which I think is huge, because it also breaks down silos and it kind of puts us all together, as one, kind of working on the problem, as opposed to different folks kind of doing things all over the place.
So thank you
Yeah,
so much,
and
Dr.
this
Go ahead.
commitment demonstrates, oh, sorry, I was going to say this commitment demonstrates and acknowledges that this is not a quick fix, right? The
Mm-hmm.
10
pipeline
years.
solution is the long game, and that is the way to go.
Yeah, 10 years is yeah. And hopefully we get in double digits, which would be amazing. So I just wanted to just recap some of the key points here. Being Black in the doctor's office can be very difficult, but it is so important that you use your voice. And if you can't use your voice, as we've mentioned here, bring an advocate, bring someone with you who can speak up for you and who's going to listen. Because one thing is, if you're going to the doctor to receive any type of news and you don't know what it is, bring somebody with you, because whatever that news may be, you might tune out, but at least that person can take notes on what the doctor is saying. Because like these cancer diagnoses, that treatment is so intricate, and it's so important that you do whatever they ask you to do at whatever time. And you need someone who's paying attention, who gets all of that information for you. So please, 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 most importantly, realize that you are part of a team and we're not dictators. This is a team. So you can ask, why do I have to take this? My favorite thing is, if the drug is not working for you, it's causing you some horrible side effect, please tell the doctor. Don't stop taking it cold turkey. Tell the doctor, whether that's through the patient portal or calling, because there's so many drugs on the market, they can find you something else. But if they don't know what's going on, when you come back in 6 months, they've assumed that you've been taking it for 6 months, and that's not good. So please make sure that you speak up for yourself. On the side of the medical students, fellows and residents, same thing. Speak up sooner rather than later. If you see that there's trouble, you're not being treated fairly or something, please find somebody you can talk to. And there are so many things going on now. I know personally there's a colleague that has started some residency thing that she helps people if they need to find an attorney because for whatever reason their residency is not treating them properly. There's so many avenues to help you. And like Micheline has told us, NMF has scholarships. So don't let money be a barrier. They have scholarships. They are trying to bring us into the fold. And thankfully, she's helping to diversify clinical trials and the workforce. So thank you so much. Can everyone please just give me your last remarks? We'll start with Dr. Lashage.
My last remark would be, whether your provider looks like you or not, check your gut about whether there's trust. And if you lack trust, you're likely not to follow the recommendations, and your own health is at stake.
Micheline?
My last comments would be, of course, to thank United Healthcare and Black Doctor for literally providing this format and this forum. I think that the discussion has been rich. My last comment to the audience would be to understand that there is power in advocating for yourself, right? And that you owe it to your future generations in order to do it now, right? Those who came before us actually sacrifice so that you could speak up. Speak up. Your life depends on it.
Dr. Poole?
Yeah, I'll echo what's been said, and mention that, particularly when we have these conversations around Blacks in medicine, we talk about the challenges. But at the end of the day, like, being a physician is an amazing career. And even though it's Dr. Lashage and I, it's not our day jobs day to day anymore, but we occasionally see patients, and when you're Black in the doctor's office or in the exam room, it's a beautiful thing. And being able to be a vehicle for God's work is an honor, it's a privilege, and it's fun. It's empowering. It's great work, and it's a great experience for everybody involved. And so it's disheartening when so many of us don't have a great experience, again in that act. And so I just would want to give that note out that this is a wonderful profession. We want as many people as possible to experience it. We don't talk a lot about it, but it also is a game changer in terms of improving socioeconomic status. I mean, Tamika talked about how she grew up, not to steal her business, but that's not the life that her children are living. All right, and my children are living a much better lifestyle than I did. So this profession literally changed my life, right? And it's done that for a lot of people, and we want to be able to give that to a lot of our folks, right? In so many ways. So let's encourage our Black physicians, let's encourage our Black patients, and again, make being Black in the doctor's office a good thing, a fun thing, a healthy thing, not just something that is rife with stress and angst and negative outcomes.
So we have actually ran out of time, but there are actually a ton of questions. So we must continue this conversation. Hopefully, this fabulous group of people will be available again in another date because we would love to address some of those questions. Thank you, United Healthcare and National Medical Fellowships. Thank you, Micheline Davis, Dr. Tamika Lashagay, and Dr. Kenneth Poole Jr. for your participation this evening. Dr. Kenneth Poole, I don't know why I put Junior on it. Did I make that up?
No.
I was right?
My
Okay,
daddy's
I
name
saw
is
it.
Jimmy.
See?
Yep, you're
See, I
right.
saw it. So thank you all so much. I hope that you all have learned something and could take something away from this conversation. I do apologize that we have literally ran out of time for the questions, but thank you. And please stay tuned to blackdoctor.org. Remember, you can come here to find Black doctors if you need to find one. And I look forward to speaking to this group again about being Black at the doctor's office. Have a good night, everyone.